Home Affairs Minister Peter Dutton has spoken about his diagnosis of coronavirus and says he expects to remain in hospital for a fortnight. But he's rejected calls from Labor for Cabinet colleagues to self-isolate. Cleaners in full protective gear have been spotted disinfecting parts of the Commonwealth Parliament offices in Sydney, where Mr Dutton attended a Cabinet meeting on Tuesday. Political reporter Anna Henderson has the latest.
Mr Dutton has done a couple of commercial radio interviews from his sickbed in hospital in Queensland, where he has told people that he is feeling better, that his fever has gone down, that he has a scratchy throat but nothing more serious at this stage. He says that according to the guidelines put out by the Queensland Health Department, he will stay in hospital for 14 days at this point, and that during that time he'll have access to his phone, his laptop and the other equipment that he needs, including a secure video line to continue his role as Home Affairs Minister, one of the most senior roles in the Morrison government. He says that the infectious period, he's been told, started on Wednesday. So the Cabinet meeting that he was involved in on Tuesday, which of course included all of his Cabinet colleagues and the Prime Minister, is outside the period. He has been told by the Chief Medical Officer that he was infectious. And following on from that, the trip he took at the end of last week, where he was in Washington with the US President's daughter, Ivanka Trump, and other senior members of the White House administration. Again, he says that's not within the period that's been deemed infectious for him. So let's take a listen to what he had to say in one of his radio interviews.
They are doing tracing now, so I've provided all that information, phone numbers, etc., to them, and their advice to me is that they're concerned with people that I've had close contact with since the morning of the 11th. So beyond that, it's not further back. I mean, there's some speculation about my visit to the White House, etc., but all of the medical advice says that there's no issue in relation to that period or even Cabinet earlier in the week, and that's the very clear medical advice that I've got.
However, the Chief Medical Officer, Brendan Murphy, today has spoken about whether or not that is in fact the guidelines, and he disagrees. Chris Bowen says, regardless of what this medical advice now is, that the public health message, the optics of this, the way that misunderstandings can evolve is part of his concern. This is what he had to say.
Of course, we have the news that Peter Dutton has been diagnosed with COVID-19. Now, of course, we wish him the best. This is not a pleasant disease, and he's in our thoughts. We wish him all the very best and his family. I've been concerned about the mixed messaging and the apparent inconsistency about the approach that the Prime Minister and Cabinet are taking, which is different to the approach recommended to members of the public.
As we see this day unfold and the news unfold on all the different angles of coronavirus, we are starting to see these pictures emerging of the deep cleaning efforts in Peter Dutton's office at Commonwealth Parliamentary offices in Sydney as a result of that diagnosis of coronavirus. And I think across different parts of the Australian community, we're going to become a bit more familiar with those kind of images as people are diagnosed with coronavirus, and there are big efforts to clean public spaces where a lot of people do gather to ensure that we don't see this virus continue to spread.